Paxlovid, once considered a wonder drug to beat back COVID-19, may not be so mighty after all. A study published in the New England Journal of Medicine on Wednesday suggests the antiviral drug does little or nothing for both fully vaccinated or unvaccinated people who have at least one risk factor for severe COVID. It did little to shorten the duration of symptoms. It is still unclear as to Paxlovid's impact on patients 65 years and older, as that group only accounted for under 6% of the study subjects. Participants recorded daily symptom severity on a 4-point scale. 0 was absent, 1 was mild, 2 moderate, and 3 severe. The included symptoms were cough, shortness of breath or difficulty breathing, feeling feverish, had chills or shivering, muscle or body aches, diarrhea, nausea, vomiting, headache, sore throat, and stuffy or runny nose.
Adults who had confirmed COVID-19 with symptom onset in the past 5 days were randomly assigned with Paxlovid or a placebo to take every 12 hours for 5 days. Patients who were fully vaccinated against COVID and patients who had never been vaccinated against COVID were eligible for participation in the study. Now, kind of shocking that a drug that costs $1,300 for a 5-course is showing in a randomized controlled trial to not really relieve COVID symptoms. That's a lot of money to pay for something that provenly doesn't work, it seems.
Yeah, and actually the federal government gave Pfizer $12 billion for Paxlovid during the pandemic, and they were able to sell $20 billion worth of it before finding out, apparently, that it doesn't do anything. And this is part of a larger trend of the medical community, and particularly big pharma, both taking advantage and repeatedly selling the American public a bill of goods when it came to COVID-19. They, of course, routinely mocked therapeutic treatments like ivermectin or hydroxychloroquine, saying that they were a fish tank cleaner or a horse dewormer, even though these medicines have been used for human treatment in different dosages for decades. And basically just wanted the government to pour all of its money into propping up the vaccine development among these big pharmaceutical companies. They didn't want people to take potentially effective therapeutics because they would take away from the desire for people to develop a vaccine. And then they had their own therapeutic treatments like Paxlovid, which doesn't even work, and made $20 billion on it. It was just such a total racket from start to finish. And I don't know how the United States is going to get people to trust the medical community again after this, because pretty much every part of their response to the pandemic ended up being either completely made up or proven not true months later.
Right. A Harvard analysis of this drug concluded it costs $13.38 to produce the 5-course treatment. They are charging $1,390 for the 5-course treatment. They're profiting off of this drug obscenely. That's a huge profit margin. And when we look at what happened during the pandemic, you had all of these big corporations saying we're experiencing incredible inflation. It's true that there were supply chain disruptions and companies had increased input costs because of this, and they raised prices proportionally. But then there were other companies that entirely took advantage of the economic climate we were in thanks to the pandemic. When we look at what profit margins were for the previous 20 years, they averaged about 11.4% during the pandemic. But during the COVID pandemic, in just the first few years, we saw profit margins soar above 40%. When we look at the money made off of price increases, from the 70s to 1979 to 2019, we find that the majority of price increases, 62%, that money went to workers' wages. During the pandemic, 54% of the money made off of price increases did not go to additional input costs because of inflation. It certainly didn't go to workers' wages. 54% of the money made off of price increases during the pandemic went directly to corporate profits. These are corporations price gouging, raising prices on necessary things like an antiviral drug during a pandemic, raising prices on food and gasoline just so they can line their pockets more. These are the economic circumstances that led to the 10 richest men in the world doubling their fortunes during the pandemic from $700 billion to $1.5 trillion just in the first 2 years of COVID. The wealth disparity we're seeing in this country as a result of somewhat a failure to regulate industry, a failure to keep in check unrealistic corporate profits when we think about the sustainability of an economy. You know, it's a failure on the economic front. It's a failure by our political leaders as well.
Yeah, a lot of politicians obviously made tons of money in stocks by trading on big pharma's stocks rising when the federal government started awarding those contracts for the vaccine development. And some got called out for it, but some of them not so much. I want to go back for a second about just the way that the American people were repeatedly lied to about pretty much everything in regards to COVID-19. And I mean, there is obviously a time period in which you can have some forgiveness for people who genuinely didn't know what COVID-19 was, didn't really understand how to fight it. But instead of just admitting that they didn't really know what was going on, in the name of, I guess, suppressing panic, the medical establishment and the public health bureaucracy instead decided that they were just going to make things up as they went along. They have admitted in congressional testimony that the 6 feet rule for social distancing was completely arbitrary, that it wasn't based on really any scientific method. There have been multiple studies now proving that masks were not this super effective way of fighting COVID-19 spread the way it was claimed to be, at least in part because most people don't have a proper seal with an N95. But even then, it's found that masks were not super effective. There was a Johns Hopkins University study that came out last year that found, and this is, I think, the biggest knock against everything that the public health bureaucracy did. It found that the lockdowns and the lockdown-esque policies that continued for months, if not years afterwards, did not save as many lives as they caused by creating deaths of despair and deaths from medical neglect, i.e. people not going to the doctor because they were encouraged not to go get their normal screenings or checkups because they would be taking away beds essentially from people who were suffering from COVID. So you have a rise in suicide, a rise in mental health issues, you have learning loss among children. I mean, everything that came along with the lockdowns ended up causing more harm than lives it saved from protecting high-risk people from COVID-19. Now we find out that this Paxlovid drug, which again, Pfizer has made $20 billion plus on, also doesn't work. This is the largest public health failure in the history of perhaps the world, at least in the United States of America.
Yeah, I think when you have a public health crisis like this, what leadership has to do, whether it's Fauci, it's going to be the president at the time, what they have to do is make decisions that are big, dramatic decisions with the best information they have that they think will keep the public as safe as possible. And I think what we experienced was a failure to communicate effectively by the CDC. They could have said, you know, we're not sure that this is going to be the thing, but with the information we have, we think that this is the best course of action right now to contain the virus and keep people safe. People would have been fine with that. To create a false sense of confidence by seeming certain about something they were uncertain about, they immediately lost the trust of the public. And of course, people were questioning their course of action. I think if they had communicated honestly about what they were basing their decisions off of, everyone would understand that. They would say, okay, yeah, we don't know much about this virus. It's brand new. But because they wanted to create this sense of, you know, we're the elites, we're very smart, we know exactly what's going on, and here's what it is, and assume that the public is just too dumb to understand what's happening. And, oh, if they get the sense that we are uncertain as the leaders, then it will cause panic. It's really an assumption of ignorance of the public. It was just one of the biggest communication failures ever that I think will be taught for many years in communications classes and public policy and public health.
And if I may
classes.
jump in just really quick before we wrap, they also tried to smear people who brought up alternative ideas for how to handle the pandemic, which to me is probably the most disturbing part is that they repeatedly silenced dissent. They pushed out people from the public health bureaucracy, from hospitals, from the Trump administration, because they raised different ideas of how to handle this. And they basically, it's exactly as you said, they thought that they were the most educated, they were the elites, they were the experts, only their voices deserve to be heard, and they cost the American people greatly because of it.
Yeah, we're going to have to leave this one here. We've got more Rising right after this.